Hello everyone, I'm Dr. Divya Joshi, Infectious Disease Consultant at Fortis Hospital, Banargata Road, Bangalore. Today, I'm going to discuss regarding the new and the latest epidemic, which is the monkeypox. Before we begin, I would like to discuss regarding the fact that the WHO has issued that this disease be called Mpox and not monkeypox because of the discrimination against the monkeys. Today's talk, I'll be exploring two important points. The first thing is regarding why has this disease become an important concern in today's world? And secondly, what is this disease? What is it caused by? What are the signs and symptoms? And what are the preventive measures that we can take for the same? So, the WHO has issued a public health emergency of international concern against this Mpox disease. The Mpox disease is caused by Mpox virus. It is a double-stranded DNA virus. It is very closely related to the smallpox virus, which is why all those individuals who had vaccination against smallpox do have partial immunity against the Mpox virus. Now, how did it all start and originate? So, this Mpox disease was first described in the monkeys, the research monkeys in 1958 in Denmark. Following that, the first case originated from the African subcontinent in Democratic Republic of Congo in 1970s. From then, there have been a surge of cases slowly to the neighboring countries and also across the globe. There are two distinct subtypes and clades, that is what we call as clades of these viruses. One is clade 1 and clade 2. The clade 1 of the Mpox virus is more virulent, more aggressive and dangerous, and which can cause more deaths. It is located in the Central African region or originated from the Central African region. The second clade of this virus is originating from the Western African side. So that is the clade 2 virus, and it is less virulent or less dangerous, and less deaths have been caused because of this virus. If you look from 1970s to 2019, slowly the cases have increased. But in 2022, we saw a lot of surge of this Mpox cases in UK, US, Europe, Middle East and other Southeast Asian countries, even including India. So far, we have 30 cases from 2022 to 2024. But there is a difference between 2022 cases and the recent cases which are coming now. So the WHO has issued a public health emergency of international concern against this Mpox disease in 2022 when the cases started rising. They were belonging to clade 2. But the recent rise of cases in 2024 which we are seeing is pertaining to the clade 1 virus, which is more virulent and dangerous. Coming to the second part of the talk, let us discuss what is this virus and what does it cause. So as I discussed, it is a DNA virus, and this virus causes the disease called as Mpox. What is the natural reservoir of this virus? It is present in the animals, it is present in non-human primates like monkeys. It is also present in some rodents like squirrels and dormites, and it can spread from the animals to humans by eating the bush meat, the scratch of an animal, also hunting the cages. If you're taking care of cage of that animal, it can spread through all of these sources. From human to human transmission can occur through sexual contact. It can also occur through close contact with the individual, through bodily fluids, also through fomites. Fomites means touching the neighboring objects. Indirect contact through fomites can happen, like the comb or using the same clothes or some tissues, etc. And respiratory droplets can also spread, human to human transmission, and the other transmission which can happen is also vertical. So pregnant lady can spread it to their kid through the vertical transmission. The incubation period, which is the time period from the exposure to the development of symptoms, is around 7 to 14 days, and in some cases can go up to 21 days. So it is important to have a duration of 21 days that the patient should be observed for the development of symptoms. The first symptom which the patient develops, it's usually the prodromal phase in which you have fever, you can have lymph nodes. The lymph nodes can be in the cervical region, can be in the axillary region, or can be in the inguinal region. It depends at the site of entry of the virus where you get these lymph nodes. It can also be generalized lymph nodes. At the same time, there is fever, body ache, headache, etc. After a period of this prodromal phase comes the period of the dreaded rash. So these rashes occur it can start from macules. Macules are flat lesions, then if it's a little raised can become papules. Slowly they become vesicles like the ones that we have in chickenpox. After that there will be a central umbilication, there is a dot in the middle, it's called as umbilicated lesions. After that slowly the lesions start crusting, and then we have the scabs. The scabs will slowly fall off and the skin starts healing. The entire part of the rash ranges from about 2 to 4 weeks. And unlike chickenpox, unlike other diseases, this virus can spread in the entire 2 to 4 weeks. Even the scabs of this disease or scabs of Mpox are contagious. So it is extremely important to isolate all of these individuals for a period of about 2 to 4 weeks till the healthy skin comes into picture. Now, why is it so much important, and why is it a concern that we need to keep a lookout? Because there are two important things. What should we do if we are diagnosed with Mpox? Is there any treatment available? So, the first thing is there are certain antivirals, which is tecovirimat, and there is vaccine immunoglobulins which we can give, and cidofovir and brincidofovir has been tried, but there has been no conclusive development regarding the same. But none of these medicines are available in India. There are certain vaccines like the Genos 3rd generation vaccine and the ECAM 2000 2nd generation vaccine, which can be tried for the pre-exposure and post-exposure patients, but unfortunately these vaccines are also not available in India. So what we have is only supportive care and measures for the disease. There are certain complications which can also develop of this disease, which includes the brain fever, which is encephalitis, the infections because of the rashes here, that is called as, or sometimes sepsis. Pneumonia can also develop. There can also be the corneal involvement or the eye involvement, which can lead to blindness because it heals with scarring. So with all of these things, it is important to know and identify, because the transmission can happen through respiratory droplets, it can happen through close contact. So if anybody who presents with an unknown rash, you have to be careful, identify, and if it is the case, visit the hospital. There has to be a positive epidemiological link. By the positive epidemiological link, I mean there has to be an exposure with this virus in patients who have been already exposed. So there are certain countries which are red alert. You have to identify those countries if there is an epidemiological exposure or there is a contact through that and these lesions and rashes are turning up. Better to visit the hospital, and from there they can carry it and take the scrapings from the lesion site, the roof, the lesion as well as the fluid can be sent to NIV Pune and other research laboratories which have been set up from the NIV Pune lab furthermore. So that is why it is extremely important to identify this disease, because no treatment effective as far as now is available in India. So only supportive care is important. In those situations, better to keep a lookout for in these cases. And as I said, isolation needs to be for 2 to 4 weeks till the lesions are completely scabbed. So I would end on this particular note saying prevention is better than cure. So it's always important to keep yourself protected, wear a mask, and if there is an exposure or if there is a contact, for all the healthcare workers who are out there, it is better to have full PPE, protective equipments, personal protective equipments, including mask, gown, including your goggles, the face shield and double protective gloves when you're handling a suspected case of Mpox. Always be on the lookout, because they might present to you with other symptoms, might also harbor these symptoms. So always ask for the past history or epidemiological exposure regarding these patients. Thank you.